11:60. I always talk tennis with Dr. Billimoria when she comes in here, and we sort of lose our focus a little bit. Dr. Nazneen Billimoria is with us this morning as we kick off Breast Cancer Awareness Month with our series of interviews. Each Wednesday at 8:10, we're going to talk about this topic and certainly what a topic it is. Breast cancer awareness, IRMC, and what they can do for you. A, in order to diagnose it, and B, in order to treat it if it turns out that it is there. A conversation brought to you by Marcus & Mack, a law firm representing injured people. Dr. Billimoria, good morning.
Good morning, Todd. Thank you so much for having me here today.
It's good to have you with us here today. A couple of things about IRMC and its approach to breast cancer. Number one, a couple of pretty good distinctions. National accreditation in 2 areas.
Yes. This was nice little feathers in our hat here, just reassuring the community that we are doing the latest and greatest in breast care. The first was the national accreditation by the NAPBC, which is the National Accreditation Program for Breast Centers. It is run by the American College of Surgeons Commission on Cancer. And they come in and they review us, and boy, I'll tell you, it's a grueling process because they don't just review us on 1 or 2 categories. They review us on 17 or 18 categories.
Wow.
And then subcategories within those categories, and we have to meet all their standards in order to achieve the accreditation. And we did that earlier this year. And it's just reassuring to our community that we are doing what the big cancer centers in the country are doing for their care. The other distinction is the Breast Imaging Center of Breast Imaging Center of Excellence. That was a distinction given to our radiology department by the American College of Radiology. And that's because we've upgraded all of our equipment. We offer really every aspect of imaging related to breast care, and it includes mammograms, ultrasounds, breast MRIs. And this is all very recent in the last couple of years that we've made all these upgrades and been able to do this for our community.
IRMC has always had an emphasis on breast cancer and breast care, but this is another step up, isn't it?
Oh, absolutely. It's another step up. And as I say, we are actually the only facility to have the NAPBC distinction west of Harrisburg.
Wow.
In Western Pennsylvania. So that is a big deal for us. Of course, UPMC, they have their own accreditation system, which is why they don't have this, but we are the only ones that have it west of Harrisburg.
It's amazing.
It is. So, it lets people know in the community that we are up to date, and we do what Pittsburgh's doing, what Sloan Kettering is doing, what, the Cleveland Clinic is doing.
Yeah. A part of all of this, of course, is you have board-certified breast surgeons. You're one of them, Dr. Dan Clark, another. But it's all part of a whole team approach to breast cancer, isn't it?
Oh, absolutely. I mean, Dr. Clark and myself are only one part of this team that requires a multidisciplinary approach. And that was one of the main things with the accreditation that we received. They want to make sure that breast centers are giving patients a multidisciplinary approach to their treatment. So that means multiple different services taking care of that patient. So in addition to Dr. Clark and myself, we have oncology with Dr. Ramanini and Dr. Kamanova. And of course, they're with UPMC Hillman Cancer Center. And that's the affiliation that IRMC has with them. And then we have Dr. Chitty, who is our radiation oncologist. Beyond that, we have all of our radiology technicians who, do the studies on our patients, who are bringing them in, doing their mammograms, their ultrasounds, their MRIs. We have our lymphedema therapist who we send patients to who have that issue after certain types of breast cancer surgery. We have our social worker, we have our dietitian. I mean, it is a full team approach.
Yeah.
And not to mention our nurse navigator,
Yeah.
Dina Deal, who does so much of this as well.
I'm sure Dina will be part of these Wednesday conversations at
Oh,
some
I'm
point
sure
this
I'm
month
sure
too.
she will. She's wonderful, and I think our patients love her, and she's just a point of contact that they have on, because this is such an overwhelming diagnosis when you first have it.
Mm-hmm.
So it's nice to have someone kind of guide you on where you need to go next.
Yeah, probably doesn't matter who it is. When you hear those words, you get knocked down.
You do. Absolutely. Absolutely. It's a big shock to the system because, most people don't think they're going to get breast cancer, and unfortunately it is one of those things that affects us all.
And unfortunately as well, most people, they hear those two words, breast cancer, they think death sentence, and it's not that way.
It is not that way anymore. And part of the reason is, number one, early detection. With our new imaging technologies like 3D mammography, we catch cancers a lot earlier. So most of the ones that we do encounter are usually in stage 1 or stage 2. So that means they have small cancers in the breast. Typically no transfer to the lymph nodes, but sometimes they do. But even if they do, the survival has drastically improved from what it used to be. And a lot of that has to do not with the surgery that they're getting necessarily, but with the adjunctive treatments that they're getting. We've been doing mastectomies have been doing for years and years. Lumpectomies we've probably been doing for the last 20 years or so. So the surgery for breast cancer really hasn't changed, but then it's the adjunctive, the chemotherapy, the radiation techniques that have changed that are now vastly improving survival for patients.
Yeah, and it's a great encouragement to realize that the advances keep coming, and so many people are dedicated to eradicating breast cancer that it's a well-funded research effort that is going on, and every day we're seeing the results of it. Now, I wanted to ask you about this because I don't want to let you get out of here before we talk about the IRMC Fun Day Breast Cancer Awareness Brunch that is going to be happening on October 21st.
Yes, and they're going to be airing our recent video shoot that we had with Dr. Clark, myself, and one of my patients, Rhonda Sickles, who is going to be talking about her experience. And that is coming up on October 21st. It's through the IRMC Foundation, who have really been instrumental in enabling us to achieve what we need to achieve, because it's with their help that we have been able to upgrade all of our technology in terms of our imaging and things. And then also recently, they have been able to help us acquire additional equipment for the operating room for when we actually do breast surgery. One of them being a breast specimen imager, which is basically a radiographic tool that we have. It sits in the operating room. So as soon as we remove a breast specimen, a little lump, we're able to put it in there and view it to see whether we've obtained the correct area, and then also evaluate margins to see if we need to go back and take some additional tissue from areas.
I bet you in your field, you look at things like coming in like that and you go, wow. What a great advance that is. You probably get those moments all the time. Don't you?
Yeah. I mean, I'm glad I'm living now and not 30 years ago, or although I was alive 30 years ago, but I wasn't in my profession back then.
The IRMC Fun Day for Breast Cancer Awareness, that brunch is going to be October 21st at noon. It's a Facebook Live event, so you don't even have to make a special trip. And the first 100 people to RSVP will get a brunch box from IRMC, and in order to RSVP, just go to irmc.org/youarethe1. The words "you are the one," one is spelled out O-N-E. So irmc.org/youarethe1. One of the things that we need to emphasize, and we do every time we do these conversations, is mammography, early detection, how important that is, and what a great advantage it is that if there is something there, that you find it as quickly as possible. It all starts with that mammogram, doesn't it?
It sure does. It sure does. And, usually October is my birthday month, so that means it is my month to get my mammogram, my annual mammogram, and that's what I plan to do. I keep, any patients I see in the office, even though I'm not seeing them for breast cancer, I'm seeing them for another, maybe another breast issue, but it's not cancer. I say, it's important. You got to get your annual mammogram along with your clinical breast exam. Now, that is for women who we consider average risk. So that means that they have no family history or anything like that. There are also high-risk screening protocols that we have in place, and those are for women who have a 20% or higher lifetime risk of developing breast cancer to age 85. And their protocol is actually annual mammograms and breast MRIs staggered 6 months apart, along with clinical breast exams twice a year. Wow. And that is the high-risk screening protocol. The average risk screening protocol is annual mammograms and breast exams every year. And, sometimes we're a little late with getting it, and that's okay. The important thing is to just go ahead and get it. Because early detection means early treatment, and we're able to cure stage 1, stage 2 breast cancer.
Yeah. Now, starting at what age for the average woman?
40.
At the age of 40?
At the age of 40, yes.
And if there are risk factors ahead of that, then you're going to accelerate that.
Yes. So if you have a first-degree family member who had breast cancer at a young age, then you typically want to start about 10 years before that person was the age at which that person was diagnosed. Now, some people who have very strong family histories, the recommendation is for screening to start at age 25. And that is with not a mammogram, because the breast tissue is very dense when we're younger and at that age. So we actually start with a screening MRI at 25. Oh, okay. And then typically nothing is required until age 30, when they start the annual mammograms and MRIs 6 months apart. And that starts, so 25, your first MRI, and then at 30, mammograms and MRIs.
All right, so we only have a couple of moments left with Dr. Nazneen Billimoria this morning. 3D mammography available with IRMC. How do people go about getting a mammogram?
So unfortunately, with COVID, we've had to eliminate walk-ins, which we used to have on Mondays. Yeah. But essentially, if you want to schedule your mammogram, you can just call either the imaging center or the scheduling center at IRMC and just say you need to have your screening mammogram done.
They'll take it from there.
And they'll take it from there. They'll get you scheduled for it.
Now, that's main campus. It's also IRMC at Chestnut Ridge.
Yes.
Other locations, or just those two?
Those are the two currently, and they are all 3D mammography, no matter where you go. Yeah. So be rest assured that you're getting the same treatment.
Yeah, wonderful. All right, so again, the IRMC Fun Day Breast Cancer Awareness Brunch, October 21st at noon. It's a Facebook Live event. So you can do it from wherever you happen to be, and go to irmc.org/youaretheone. The first 100 RSVPs get a new brunch box, a free brunch box from IRMC. But you will benefit from this just by attending and watching that. Dr. Billimoria, thanks so much for coming in.
Thank you so much for having me, Todd.
It is the voice of Indiana County, WCCS, 101.1 FM and AM 1160.